everybody, Rachel here. Today I'm going to talk about Healthy People 2020 because we would all like to be healthy right now, and also data. So much data? The first time a national public health agenda was set in the U.S. was in 1979 with the publication of the Surgeon General's Report for Health Promotion and Disease Prevention. In this report, 5 overarching but quantifiable goals were established for improving the health of all Americans. These 5 goals were: 1. A 35% reduction in the infant mortality rate. 2. A 20% reduction in the number of deaths among children ages 1 to 14 to fewer than 35 per 100,000. 3. A 20% reduction in the numbers of deaths among adolescents and young adults to fewer than 93 per 100,000. 4. A 25% reduction in the numbers of deaths among adults ages 25 to 64. And 5. A 20% reduction in the average numbers of days of illness for adults ages 65 and over. Woof, those were ambitious. The plan was for disease prevention and risk reduction through behavioral change, and they expected that these goals would be reached by 1990. They didn't just come up with these goals and hope for the best. In 1980, a second report was published called Promoting Health, Preventing Disease, Objectives for the Nation, which outlined 15 strategies for achieving those 5 goals through the use of specific actions. This document has provided the framework for the design, implementation, and evaluation of public health activities in the U.S. for the past 4 decades. A mid-course review was done in 1985 to evaluate the success of the program. But unfortunately, this review found that only 13% of the objectives had been met or surpassed, and even worse, only 52% of them were projected to be met by 1990. So it was decided to do this again, aiming for the year 2000, with the big goals being less specific this time. 1. Increase the span of healthy life for all Americans. 2. Reduce health disparities among Americans. And 3, provide access to preventive health services for all Americans. Oh, the optimism, well, of all of them really, but especially that third one. This new plan was called Healthy People 2000, and though the big goals were less specific, the downstream strategies expanded into 22 topic areas. And several public health agencies were designated to coordinate activities of the now 300 specific objectives. This time, the mid-course review was even worse. Only 8% of the targets had been met or surpassed. In fact, there had been negative progress reported on 18% of the objectives. They also found that inadequate data were available to effectively report on 20% of the objectives. They didn't even have baseline data for 6% of them. But they were working on these problems. An electronic inventory of data sets relevant to monitoring the Healthy People 2020 objectives was set up at the national level. And the mid-course review actually developed into a 2-year process that led to revisions of the objectives, and then published those revisions so that the public could review and comment on them. As a result of this, 319 more objectives were created. It should go without saying that none of this is easy. The United States is a huge country with a diverse population, as well as having a government that is divided between a federal level and 50 different states, plus all the territories, and then the local levels. Getting all of these agencies working together to effectively implement a big public health goal like this is extremely difficult and requires incredible dedication, consistency, and cooperation, plus money. But we keep trying, coming up with new 10-year goals and objectives for improving the health of all Americans every 10 years. Even before the Healthy People 2010 review came out, the Office of Disease Prevention and Health Promotion developed Healthy People 2020. This time, the 4 overarching goals were: 1. Attain high-quality, longer lives free of preventable disease, disability, injury, and premature death. 2. Achieve health equity, eliminate health disparities, and improve the health of all groups. 3. Create social and physical environments to promote good health for all. And 4. Promote quality of life, healthy development, and healthy behaviors across all life stages. Now, there are approximately 1,300 objectives organized into 42 topic areas. The National Center for Health Statistics is the agency responsible for monitoring the progress towards these Healthy People 2020 targets. They conduct research and develop methods for measuring progress and health disparities. There's also the Healthy People Consortium, which is a diverse group of organizations that promote and implement Healthy People 2020. Consortium members each have a mission that aligns with either the project as a whole, one of the 42 topic areas, or one of the specific objectives. And each state and territory also has a Healthy People coordinator who serves as the liaison with the Office of Disease Prevention and Health Promotion. Progress reviews were planned to be presented to the public as webinars, highlighting both the data and also action that was happening at the federal, state, and local levels. Each one of the 42 topic areas was planned to be featured in a webinar once during the decade from 2010 to 2020. In general, Healthy People 2020 has 3 types of objectives: measurable, developmental, and informational. Measurable objectives are ones that have a national baseline value that is derived from currently established and, where possible, nationally representative data systems. Unfortunately, we don't have those for everything that we want to examine, so developmental objectives indicate areas that need to be placed on the national agenda for data collection. And informational objectives are those that we know are of public health importance and we have baseline values, but we haven't established targets yet. Because 1,300 is a lot of objectives, Healthy People 2020 uses 2 ways to focus attention on specific areas. One is the Foundation Health Measures, which monitor improvement, hopefully, in population health in the broadest sense. They are organized into 2 tiers. Tier 1 is healthy life expectancy, the average number of years of healthy life a person can expect if age-specific mortality and morbidity rates remain the same throughout their lifetime. This provides a snapshot of current death and illness patterns, indicating the long-range implications of the prevailing death and illness rates. You'll often see healthy life expectancy reported at birth and at age 65, and Healthy People 2020 uses those time points too, tracking them using 3 measures: the expected years of life free from activity limitation, free from disability, and in good or better health. Tier 2 drills down a little more, separating the measures of healthy life expectancy into their component parts: straight up life expectancy, activity limitation, disability, and respondent assessed health status. In this case, activity limitation is a long-term reduction in a person's ability to perform their usual activities, such as working, personal care, or remembering. Disability, on the other hand, describes people at risk of a limitation in their ability to participate fully in society. In order to see if a person has a disability according to this definition, there is a set of 6 questions that were developed for the American Community Survey. These questions ask if a person has difficulty in any of the 7 domains of functioning: hearing, seeing, concentrating, remembering or making decisions, walking or climbing stairs, dressing or bathing, and doing errands alone. And respondent assessed health status is solely a measure of how a person perceives their own health. It's assessed by a single question asking the respondent to rank their health as excellent, very good, good, fair, or poor. The life expectancy at birth for Americans in 2014 was 76.4 years for men and 81.2 years for women. And at age 65, it was 18.0 years for men and 20.5 years for women. This means that on average, people who lived to age 65 in 2014 could expect more years after age 65 than those who were born in 2014. The healthy life expectancy at birth for Americans in 2014 was 68.1 years free of activity limitation, 66.0 years free of disability, and 70.4 years in good or better health. None of this actually predicts a particular person's specific lifespan. These are population measures and need to be viewed in aggregate. The other method Healthy People 2020 used to organize those 1,300 objectives is something they called the leading health indicators. These were selected to show which objectives were considered the priority health issues and what actions could be taken to address them. The leading health indicators for Healthy People 2020 are access to health services, clinical preventive services, environmental quality, injury and violence, maternal, infant, and child health, mental health, nutrition, physical activity, and obesity, oral health, reproductive and sexual health, social determinants, substance abuse, and tobacco. The plan was to use these leading health indicators to assess the health of Americans, to facilitate coordination across sectors, and to motivate action at the national, state, and community levels. For instance, the concept of social determinants is the critical role that the home, school, the workplace, the neighborhood, and the community play in determining health. People who have a quality education, stable employment, and safe home and neighborhoods tend to have better health than people who don't have those things. This is, at least in part, responsible for the unequal and avoidable differences in health status within and between communities. So Healthy People 2020 has objectives to try to improve the social determinants of Americans. One objective evaluated for the leading health indicators is the percentage of students who receive a high school diploma 4 years after starting 9th grade. In 2008, the baseline for the Healthy People 2020 objective, the number was 74.9%, and the target was 82.4%. In 2010, the number was 78.2%, which is classified as improving, since it has achieved at least 2/5 of the targeted change. For oral health, the objective evaluated for the leading health indicators is the percentage of people who had visited the dentist in the past year. Oral diseases can cause pain and disability for millions of Americans, as well as being associated with an increased risk of heart disease, stroke, diabetes, and Alzheimer's disease. In 2007, the baseline, the number was 44.5%, and the target was set at 49.0%. In 2011, the number was 41.8%, which is unfortunately classified as getting worse. You might have noticed something about those dates that I've been saying. There is a lot of data on the healthypeople.gov website, but unfortunately, none of it is particularly new. Now, as I've talked about in the past, it takes time to compile these reports. Think about how many data sets need to be assembled to evaluate just one of these objectives. But even so, I would have expected more data and newer data to be there. Also, those webinars that were supposed to be presented to the public, well, I'm not seeing many of those there either. It's difficult to say exactly why this is, but it's certainly public knowledge that the budgets and personnel for many departments, including the Office of Disease Prevention and Health Promotion, have been cut recently. Something this huge, monitoring and improving the health and lives of all Americans, needs significant resources. And if I can get up on my soapbox for a little bit, we all need to do our part to make sure that those resources are there. We need this for our health and for our future. this video. If you did, and you think you'll be interested in more videos about public health, click like and subscribe. Thank you. I hope to see you soon.